When surgery may actually appropriate for you and your core healing and restoration.
Hey there, I'm Celia, women's health and pre- and postnatal specialist, nutrition coach, trainer, and mom of 4. I help women feel strong and confident in every season because a strong you is an enabled you. You matter and you are worth being well. Let's dive into today's topic.
So in parts 1 and 2, we talked about how surgery isn't our first option. So in part 3, when is surgery, we're going to talk about actually appropriate. This conversation matters because my goal is not to tell you that surgery is always bad. Surgery is needed sometimes and is absolutely a right choice for specific situations. It's not our first choice and our only option, okay? But it does have its place in time. Possible situations where surgery may be considered or needed for you. Again, this is between you and your surgeon, but significant functional limitations, hernias, severe abdominal wall and weakness, persistent symptoms despite steady and consistent conservative rehabilitation efforts, maybe ongoing pain and certain life quality limitations, or you could have larger abdominal defects going on. Surgery is not always just simply about aesthetics. It does have a purpose into restoring that function and structure again in the core, and conservative management has not been able to be enough. But here is what matters, and here are a few reminders. Trying rehabilitation first isn't doing nothing. It's using our body's natural ability to adapt. Many women improve dramatically or fully with progressive rehabilitation, like I talked about in parts 1 and 2 of this conversation. This is why I advocate for you to first rehab through those efforts, okay? Some women in the end, though, and in severe situational cases, ultimately may need surgery. And I just wanted to encourage you and remind you that is okay if that is appropriate for you in the specific situation. General situations, postpartum core surgery is not appropriate. For specific situations or cases listed here, then yes, it may absolutely be appropriate for you to consider surgery at this time. The goal for me isn't to prove one side or to shame anyone who has had surgery. It's to educate, to empower, and to enable. Okay, I want to help you become stronger. I want you to help you become more functional in life and supported through education and knowing what is out there for you and the options that you have. And by you knowing what is in your control of your body and what your body is capable of, and that is my goal. Surgery has its place in time. It's just not our first option, and it is very circumstantial, and that is what I want to communicate to you. Strength is not just about how your body looks, it is about how our body functions. So regardless of what route you need, okay, I want you to know that it is so much more than aesthetics, and it is about quality and enablement in your life. It is about how you feel and function on an everyday basis, and that matters because you matter. You matter, and you are worth being well. I am here to support women, moms, and advocate and enable you. You guys are so busy. We are all so busy. I'm a mom of 4, taking care of all of those around us. We are natural caregivers and nurturers, and that is a wonderful God-given thing. But often we are so busy outpouring everyone that we forget to pour into ourselves. And so my passion and my purpose on this page and in all that I do as a coach and a women's health coach and trainer and one who is specialized not only in women's health, getting specialized in menopause, but also specialized in postnatal, is to be your advocate and to be the person that as you are busy taking care of everyone around you, I am here to say, hey, I'm going to help you take care of you. You matter too. My goal is not to shame anyone who has had surgery or who needs surgery. So this is why I wanted to make part 3 purposely and intentionally. I want you to know that surgery does have its place. I am also not the person that demonizes doctors in modern medicine and only goes the crunchy natural route. I personally believe in a human evidence science-backed approach. I have a foot in both worlds and both serve a purpose, and I have so much respect for surgeons, okay? I simply want you to know that those videos in part 1 and 2 are to educate you on the surgeons that aren't up to date on research or do not have your best interest in mind, and that are telling you surgery is your only option and the only way, and that tissue is dead tissue. That is not true. However, this video is for the mama who has done all the things, who has done her research, who has advocated for herself, who has taken the time and is still having persistent symptoms past consistently putting in those progressive efforts with core healing and restoration and breath work and healing in those programs. Maybe you're also dealing with hernias or certain things or prolapses, whatever it is. I just want you to know, then yes, surgery is appropriate for you. No guilt, no shame, no discouragement from me, okay? Encouragement to do what is right for you in your specific situation as an individual. Surgery shouldn't be your first option, okay, if you're dealing with weak core or needing that linea alba tension restored. So I do want to encourage you to first go and focus on rehab. If you are looking for a program, I do offer that in my app. My main goal here isn't to just push and promote my app. It is to encourage you, to educate you, because I believe education and knowledge is so much power and empowerment and enablement to us moms and to us women in our health. You are the best advocate for your health. And so I just want to encourage you to first know that healing is possible through those other measures and that you should absolutely try those first. But then if you have done that, or if you're dealing with specific situations, surgery has its place and purpose and may be right for you at this time. So just know that my goal is to never shame anyone. It is to encourage and to enable. And so I also wanted to make part 3 covering when surgery may be appropriate and a good thing and how it does have its place in time. I want you to think of all of these things we're learning in our health and fitness, or with diastasis recti healing and core rehab, or anything with our postpartum pregnancy journey, anything in our wellness journey. I want you to picture a toolbox and how we have all of these go-to tools in that toolbox, right? So I want to talk about all the tools that we have in that toolbox so we know how to use them and apply them in the right and appropriate situations. Surgery is a tool in the toolbox, okay? It's not your go-to tool. It isn't your drill or your hammer that you go to all the time, okay? And I know I'm using a little more of a masculine analogy, but that is just how what my brain always operates as, looking at these tools in our toolbox as women and mamas. Surgery is a tool in that toolbox, and it is appropriate for specific situations, especially, when you're dealing with severe things. It is a tool for a time that we do take out now and then. So this is going over that today to encourage you and support you in that way. Remember, you matter. You are worth being well. Whatever route you need to take it, okay? Because you matter. And not only are all these little lives depending on you as a mama, but your life has purpose. You have purpose, you matter, and you are worth being well. So take care of yourself. I am one mama over here on the other side of the screen, advocating for you, cheering you on. I'm in your corner every single step of the way. Truly know that. From one mama to another, I know it's so hard to get to the appointments, to find the sitters, to have the consult, and to have the surgery, and to be laid up, and to go through rehab, but it matters. It matters so much, not only to all the lives that are dependent on you, but because you matter. You need to do it for you. So this is your reminder today to prioritize you, to prioritize your health and your needs, because you matter and you are worth being well, mind, body, and soul.
If this video was helpful, I would love it if you liked, subscribed, and turned on that notification bell. And if you want deeper support, workouts, and education, you can find everything linked in the caption below or the link to the app in my bio. Thank you for being here, and remember, you matter and you are worth being well, mind, body, and soul.